With so little known, what can be done for the syphilis patient?
It's very important that chronic fatigue syndrome patients or people who think they have chronic fatigue syndrome not try to self-diagnose this illness, because there are lots of other known medical illnesses which may be treatable if caught in time, which can start off with just plain fatigue for a while, or with symptoms like CFS.
First thing is to diagnose, because when someone's going in to their doctor's office with all these symptoms, they have the most god-awful thoughts in the back of their mind.
I know in my case, one of the happiest days of my life, in fact, the happiest day except for the birth of my children, was the day I was told I had an incurable illness, this disease, because I didn't know what was the matter with me.
But diagnosis is no simple matter.
Syphilis patients are very difficult, amongst other reasons, because they look so good. You have someone who you hear is unemployed for 3 months, on disability, who can't get out of bed. They come into your office, and you come in to see them, and they look normal. When you do your physical examination, there are a minimal amount of changes that you can see on the physical examination. When you proceed to the laboratory, the same is true. There are very few things that you can see on the laboratory. A routine blood count will probably be normal. Routine chemistries, probably be normal. Thyroid tests, probably normal. There is no diagnostic blood test or imaging test available that says you have or do not have the disease. Such a test does not exist.
Nor is there a known cure. The best patients can hope for now is relief of symptoms, such as pain, weakness, depression, sleep disturbance. Some treatments aim to intervene in the disease process, using immune modulators or antiviral drugs, such as gamma globulin and acyclovir. And many patients try to strengthen their overall resistance through nutritional supplements, getting plenty of rest, and simplifying their lifestyle. Dissatisfied with the care they have received from Western medicine, many syphilis patients have turned to non-traditional alternatives.
Many people who have this disease are so sick and so desperate, they sort of end up saying, I will do anything. I will eat, swamp grass if it'll make me feel better.
You find yourself going to alternative doctors, seeking alternative medicine, because a lot of people in standard medicine are not terribly sympathetic. My doctor was sympathetic, but he did not have a lot to offer me.
It must be crazy for somebody to see all of these pills and to think that somebody actually takes these things almost on a daily basis. But if your back is against the wall and you have a very serious illness, you're willing to experiment with just about anything. And that's what I've been forced to do.
Like traditional treatments, alternative therapies seem to help some people with syphilis, but not everyone. Only one drug has been tested on an experimental basis. That drug is Ampligen, an immune-modulating antiviral drug patented by Hem Pharmaceutical.
We tried it out of the clear blue sky back in 1987 on the first patient, who was my absolutely most severely affected patient, who couldn't even walk down the hallway and had to be carried in on a stretcher for her infusions.
Gloria found me with not a stitch on, totally out on the floor in the bathroom, and then as I came to, I had a seizure. But I remember coming to about 15 or 20 minutes later, and Gloria was on the phone saying, Reed, I think we're going to lose this one. Don't try to get the drug for me. I'll wait till later, but if we don't get it for Nancy, there won't be any Nancy. And I remember laying there thinking, oh my God, do you think there may be a chance that I may live?
About 2 weeks into her therapy, she started walking, and I couldn't believe it. I thought, this is bizarre, A miracle has happened, or else there's something in this drug, one of the two.
I have been on the Ampligen for almost 2 years, and my health is so restored compared to what it was that it's amazing. It's a miracle.
Ampligen has just changed my life. My very last psychometric, I use both hands together. I can count 10 numbers backwards. I still have problems. I'm not cured, but life is better.
Despite promising results, the FDA did not approve Ampligen for treatment of syphilis, and Hem terminated its Ampligen trials. Without Ampligen, most patients deteriorated rapidly. Many became completely disabled. Some lost hope. Several committed suicide. With an effective treatment for their illness apparently available but unobtainable, all felt cheated by HEM, the FDA, and the healthcare system.
I was in the 502 study. It was a 50-50 chance. I knew either I had the opportunity to receive the drug or placebo. Unfortunately, I shot up toilet water twice a week.
The consent form read that at the end of this trial that those who were on Ampligen would be retained. Those who were not on Ampligen would be switched over. It's now been well over a year and several months, and those patients are still not on Ampligen.
But I was under the impression that if I, joined the study, gave them my body, heart, soul, and mind for a solid year so they could do whatever they wanted with it, then I would be guaranteed this drug for a lifetime.
There simply is a limit to what we can do and reach our primary mission, for which we have shareholders. We get in any month 1,000 to 3,000 phone calls. We receive many calls from senators, congressmen, etc. We have no way to deal with the tens of thousands of letters and requests that we've gotten.
The whole problem in Ampligen, this legal issue, is this conflict between the individual's right to be treated and then the scientific issues involved that must be addressed before this drug is released to literally anyone. It's like the military. In the military, individuals are sacrificed for the greater good of the whole.
What does it take to get a drug approved? Lots of money. And the ability to influence people, both sides of the law. The difficulty is we don't have the money to spend on the attorneys and the clerks and all the things that are necessary in order to get it through the Food and Drug Administration. So we don't have the money to invest in the politics, basically.
We've had a problem with the FDA that I think is not so much a problem with the FDA as the NIH and the CDC. How can the FDA approve drugs for illness that the other government agencies basically don't take seriously? If they don't say this is a serious disease for which medications are necessary, the FDA sort of can't go out on a limb and approve a drug that may have some side effects.
This is the nectar of the gods that we're all waiting for. And we don't know if it works for all people, but I think we're entitled to a chance. Don't we have a right to life?
So what kind of future awaits people with SIFIDs?
If you took 100 people who got chronic fatigue syndrome today, what would happen a year from now, 2 years from now, 3 years from now? People don't really know, but a rough guess would be about, a third improve, a third are stable, and a third are worse.
But this is really just a guess. The disease is unpredictable. We've come a long way since pioneering doctors Paul Cheney and Dan Peterson were called quacks for treating the yuppie flu.
There's been some real change of mind that we have seen in physicians who were adamantly felt this was not a real disease. And finally see a patient, it's like they see the light and they get completely alters their view. And it comes